Indiana Newsdesk is made possible in part by Smithville Fiber Internet, streaming TV, home security and automation in Southern Indiana. More information at smithville.com. Maller-Grodner Attorneys, providing legal services to clients and the community. Understanding, expertise, results. Bloomington and Indianapolis. LawMG.com. IU Alumni Association, connecting IU's network of alumni and sharing the Indiana spirit through scholarships, advocacy, and volunteerism. Alumni.iu.edu. IU Center for Rural Engagement, extending IU Bloomington resources to improve Hoosier lives in partnership with communities and organizations. Rural.indiana.edu. And by WTIU members. Thank you.
Coming up on Indiana Newsdesk. A mass shooting at an elementary school in Texas has Democrats calling for gun reform. But experts don't expect much to change here in Indiana.
No amount of death, I think, will move them from that current position. If this does not do it, if Newtown didn't do it, if Parkland doesn't do it, then what does it? Indiana's governor says the focus should be on hardening schools. A leaked Supreme Court draft has abortion rights advocates concerned about the future in Indiana.
People who don't have transportation or time off work, those are the people who are most affected now and are going to continue to be.
And a new study on healthcare costs shows Indiana is one of the most expensive states in the nation. Those stories plus the latest news headlines right now on Indiana Newsdesk. Welcome to Indiana Newsdesk. I'm Perry Metz, in for the vacationing Joe Wren. This week's shooting at a Texas elementary school killed 19 children and 2 teachers. It has once again sparked a national debate on gun laws. But as Holden Absher reports, little change is expected.
Following the deadly shooting Tuesday, 2 background check bills were heard for the first time in the U.S. Senate. The bill passed the Democratic-led House last year, but IU law professor Jody Madera expects them to fail in the Senate, where 60 votes are needed to pass the legislation. The Senate is split 50-50 between the 2 parties. She says that when Democrats call for gun reform, Republicans respond with thoughts and prayers and mental health. No amount of death, I think, will move them from that current position. If this does not do it, if Newtown didn't do it, if Parkland doesn't do it, then what does it? Madera says lawmakers are afraid of well-funded gun rights organizations such as the National Rifle Association. They worry that if they don't toe the party line, they'll lose votes and won't get the A rating. Even though background checks should be bipartisan, unfortunately, such measures are still viewed as political and therefore controversial. Indiana's 2 Republican senators, Todd Young and Mike Braun, both issued statements expressing sadness over the shooting. They also pointed to the state's red flag laws that are designed to keep guns out of the hands of criminals. In his statement, Young said, quote, "We must work together as a nation to address the increasing social alienation and mental health challenges affecting too many Americans." Brady United is a nonprofit anti-gun organization. It reports that Young has received $2.9 million in donations from the NRA. Braun has received $1.2 million. Indiana Governor Eric Holcomb says that the state will continue to support school security.
I think that we need to focus on making sure, in this case, schools maintain their integrity. You might call it hardening them when children are in the classrooms. That's what we need to focus on.
But Holcomb advocated against new gun regulations or halting a new law taking effect July 1st, which eliminates permits for carrying a handgun in public. Holcomb says focusing on anything outside of securing schools is, quote, taking our eye off the problem.
Folks who are struggling with mental health issues, violent mental health issues, evil that lurks, whether it's in a school or a playground or you name it, parking lot. This is the world we live in.
Paul Helmke is a former president of the Brady Campaign to Prevent Gun Violence and a 3-term mayor of Fort Wayne. He says it's time for officials to act.
Tired of just hearing from electeds, we support the Second Amendment. I support the Second Amendment. The Second Amendment allows reasonable gun regulation. That's what the Supreme Court has said. Stop saying you just support the Second Amendment. Stop saying your hearts and prayers are out there. Do something.
For Indiana Newsdesk, I'm Holden Apsher.
The deaths in Uvalde, Texas, represent the deadliest school shooting since 21st graders and 6 teachers were killed at Sandy Hook Elementary School in 2012. Indiana abortion providers were sent scrambling earlier this month after a leaked Supreme Court draft suggested that Roe v. Wade could be overturned. Mitch Legan is in Bloomington and has more on how Hoosiers would be affected if the landmark decision is reversed.
Almost 1.5 million Indiana women could lose reproductive rights if Roe v. Wade is overturned. Most wouldn't be able to access abortion services here or at any of the other state-approved abortion locations. That's because Indiana Republicans have vowed to increase abortion restrictions as soon as they're able. Now, abortion advocates are trying to plan for that uncertain future.
Wednesdays are just Marchbank's busy day.
And then everybody gets wet wipes.
Packing diaper bags is part of her role as state programs manager for All Options Pregnancy Center in Bloomington. Marchbank calls it a reproductive justice center for the area, helping women with all options through the pregnancy process.
I might be handing diapers and wipes out the back door and then answering emails and texts from people who are seeking abortion funding. And I'm currently fielding 60 to 75 a week for people to receive abortion care.
Her center doesn't provide abortions, just connects people with resources. And she's spending a lot of time on the phone now, since the Supreme Court leak suggested abortion regulations could be sent back to the states.
We have seen a spike in anxiety.
She knows Republican legislators have promised to restrict abortion if federal protections are lifted, and that concerns her. But she says really, it'd just be one more hurdle for Hoosiers who are currently seeking an abortion.
If Roe is overturned, the same people are going to be struggling the same way that they are now, maybe a little bit harder.
Planned Parenthood characterizes Indiana as a state hostile to abortion. The state allows abortions through 22 weeks, but regulations ensure they almost all happen in the first 13. There are 7 approved abortion centers, most of which are in the northern half of the state. And state law requires 2 separate visits for an abortion.
And then on top of those barriers, they're looking at $500 to $900.
Women deserve better. When babies lie under attack, what do we do?
With reproductive rights under threat, advocates have been taking to the State House to show support and encourage legislators not to strengthen restrictions.
People who are able to carry a pregnancy should be able to terminate that pregnancy for any reason or no reason at all, simply because they do not want to be pregnant, and that politics does not belong in something that is so deeply personal.
Even before the Supreme Court draft leaked earlier this month, 110 Republican lawmakers signed a letter asking the governor to call a special session if the court were ever to overturn Roe. Both Speaker of the House Todd Huston and Senate President Rod Bray declined interview requests to discuss what restrictions would look like, but they provided statements saying they'd wait to see how far the Supreme Court went and would look to increase protections for unborn children.
Right now, all options are on the table, and I'll wait until I see the final decision, not a leaked draft.
At least 26 states are expected to restrict abortion if Roe is overturned, including most in the Midwest. If Indiana's one of them, Hoosiers will likely head to Illinois.
We've been seeing this for a few years. It has been increasing in recent months, and we definitely expect it to rapidly increase once the Supreme Court overturns Roe.
The state made abortion a fundamental right for women in 2019. But officials at Planned Parenthood there have been preparing for a post-Roe world. They're expecting anywhere from 2 to 5 times the number of patients they're currently seeing, so they opened 2 of their newest abortion clinics on the Wisconsin and Indiana borders.
Those were decisions made not just on meeting a need here in Illinois, but anticipating a future where people from other states are going to need us more and more.
There were roughly 7,300 abortions in Indiana in 2020. Advocates say those women will leave the state if they can or resort to unsafe methods that put the mother at risk. Marchbank says a reversal of Roe would be damaging to many Hoosiers, but her job won't change much. She'll just shift more resources to connecting women with abortion funds that would help them travel out of state and pay for their procedures.
The most marginalized populations who are already struggling to access care, people who don't have $500 of disposable funds, people who don't have transportation or time off work, those are the people who are most affected now and are going to continue to be.
Some abortion advocates are saying if Republicans do go through with their plan to restrict abortion here in Indiana, then they should be willing to pay more for social services for young mothers and children. We'll get a better idea on that closer to the legislative session. For Indiana Newsdesk, I'm Mitch Legan.
The Supreme Court ruling that could overturn Roe v. Wade is expected sometime next month. Lawmakers voted Tuesday to override the governor's veto of a bill to ban transgender girls from girls' school sports. Indiana Public Broadcasting's Lauren Chapman reports the ACLU of Indiana has already filed a lawsuit.
The votes in both chambers to override the governor's veto were basically identical to the votes to pass the bill during session. House Speaker Todd Houston said before the override votes in both chambers, the bill is good policy in Indiana.
Protecting girls' sports, that's what our focus of the bill is, and again, we feel good. Attorney General, I understand, feels good about defending this if there is court action, and we believe it's the right public policy for Indiana.
Immediately following the vote to overturn the veto, the ACLU of Indiana filed a lawsuit. Katie Blair is the Director of Advocacy and Public Policy and said the legislation was unconstitutional and hateful.
We're going to do whatever it takes to protect trans children and make sure that they know that they are loved and they belong in the state of Indiana.
Senate President Pro Tem Roderick Brace said the state was prepared for lawsuits against the bill.
We don't like to get the state of Indiana sued, but it happens from time to time, and it's a policy that I think we can stand behind.
Governor Eric Holcomb said he did not advocate for letting the veto stand, calling the effort fruitless in response to Republican backlash. He said the bill doesn't solve a real problem in Indiana.
The IHSAA has been very clear and effective in making sure girls/women's sports in the state of Indiana, that competition and that integrity is not threatened.
For Indiana Public Broadcasting, I'm Lauren Chapman.
Barring a court ruling from the ACLU's lawsuit, the bill will take effect July 1st. Coming up next on Indiana Newsdesk. We talk with an IU professor in Ukraine who is studying the refugee crisis spurred by Russia's invasion. And healthcare costs in Indiana are among the highest in the nation. One physician is urging the state to do something about it. These stories and more right here on Indiana Newsdesk.
Public media's role now is more than ever to get the facts out, to be as transparent as possible, and to tell the truth as we know it.
There's a lot of information out there, and it's really hard to know what you can believe, which is why I think people turn to us again and again.
It's public media's role to try to help educate and enlighten.
PBS continues to be one of the most trusted institutions in the country.
We really do go out and meet the moment as it's happening.
We are there at the front lines asking tough questions and getting important and robust answers.
We're playing a major role in combating lies, fake news.
As journalists, we are trying to bring the most fair coverage that we possibly can.
It's about digging deeper and talking to the powerful and especially to the powerless.
Public media is the place where you cut through all the noise.
We move forward by staying true to our values.
And on PBS, news is human.
Welcome back to Indiana Newsdesk. As the war in Ukraine enters its third month, an Indiana University professor is traveling back to the area to continue her research. Elizabeth Dunn is director of the IU Center for Refugee Studies and is studying the humanitarian aid response in Europe, where an estimated 15 million Ukrainians have been displaced by the war. Mitch Legan talked with her over Zoom to discuss the latest on the ground in Ukraine.
Can you set the scene for me, what it's like when you're there? I mean, I can't even imagine. What is just day-to-day life for you like?
I am outside of Przemyśl, Poland, and I have been working here on the Polish-Ukrainian border.
People are passing through the border point at Medica, which is like Marrakesh. It's like being in a Moroccan bazaar with people handing out coffee and tea and sandwiches and clothes and phones. And then they go onwards to the rest of Europe. But what's really important is that a lot of people are feeling like they need to get back. They need to support their husbands who are fighting, because men ages 18 to 65 are not allowed to leave. So people are going back. They're trying to support the war effort inside Ukraine.
Are people starting to come back into Ukraine more? Is that where more of the aid's focused on now?
So most of the aid response now has gone into Ukraine, particularly to the city of Lviv in Western Ukraine, which has never been occupied by the Russian military. So that's now the center of aid. So we'll be following the international aid agencies in. The international agencies took a good month or 6 weeks to get going, which was too late for the initial response because millions of people came out before then. But they're now up and running and centered in Lviv. So we'll look at how they're helping people who are internally displaced inside Lviv or inside Ukraine. And then we'll be going to the capital, Kyiv, especially to interview people at the Kyiv School of Economics. And this is a group of academics who have raised $30 million for emergency needs, particularly for the territorial defense and for just general household needs for people in the city of Kyiv, which was occupied by Russian soldiers. And the Russians were eventually pushed out of Kyiv by everyday people who had signed up for the territorial defense. So it's kind of a miracle story, and we'll be talking to people at the Kyiv School of Economics who raised millions and millions of dollars to do this.
How is the European refugee, maybe international refugee network, you study this, how would you say it's done handling this incredible influx of displaced people?
I think that the international aid community has done very little, frankly, to help this enormous refugee movement, the biggest since the end of World War II. The bulk of the work here has been done by local Polish people, Polish volunteers, with some aid from the Polish government, particularly government at the local level and at what would be like the state level for us.
A lot of our viewers will obviously be familiar with the influx of Afghan evacuees that we got. Is there any comparison for these two events?
Yeah, I think, of course, the Afghans actually experienced a lot less trauma than the Ukrainians because they had to leave so suddenly and so fast. Where the Ukrainians, many of them spent months inside Ukraine experiencing the war before they could get out of territory that had been occupied by the Russians. But the similarity is the open hearts and the open hands of neighbors and friends. And, I'm here, I spent today in Rzeszów, Poland, which is a town I've been working in for 30 years. And what I saw was the same thing I saw in Bloomington. I saw everyday people who literally just opened their doors, gave their spare bedrooms, gave people clothes and food and a warm welcome. And they didn't treat them like the beneficiaries of charity. They treated them like neighbors.
You can view Mitch Legan's entire conversation with Elizabeth Dunn on our website at WTIUnews.org. Preliminary data from a nonpartisan study reveals a troubling but familiar trend in Indiana healthcare. It's among the most expensive in the country. But the newest data revealed an even more surprising trend. Brock Turner reports.
For cancer patients in Fort Wayne, Dr. Lakshmi Agarwal provides a glimmer of hope. She's an oncologist and part of a declining number of independent physicians. Her advice to patients concerned about high prices is do your research, but that's not easy for many of the folks she's caring for.
My patients are elderly, tired, beaten up by their cancer patient. How dare I tell my patient, look at your bill, look at what it costs you. Have the numbers gone up drastically? Ask the question why. Ask for a bill breakdown. How can I even say that? So what am I supposed to advise? I don't know. I'm only inside looking at the ugliness.
Agarwal doesn't believe the state can reverse course and lower healthcare costs without significant reform.
The healthcare industry is diseased in America. And that's the problem. And we're putting big Band-Aids and throwing a lot of money after a diseased system. The whole system is sick.
The diagnosis largely depends on who you ask. Almost everyone interviewed agrees the problems are complicated and multifaceted. Providers like hospitals argue more transparency has lowered prices, and they're lobbying lawmakers to give them more time to find market solutions. This comes on the heels of House and Senate leadership asking healthcare stakeholders to find solutions to the high prices.
It's important to remember that the results of the RAND study are prices that have been, I would say, negotiated, but in some cases dictated by the largest insurance companies.
Insurance companies place some of that blame back on hospitals, though.
I mean, the trend continues, doesn't it? They've done numerous studies, and, you know, this is the RAND, but you've got other studies that have been cited that have consistently shown Indiana hospitals are some of the most, if not the most, in certain places, expensive in the country.
Wood's referring to the fourth iteration of a study that looks at how hospitals charge private payers for procedures. Public rates are largely set, but private rates are negotiated and often higher, in some cases a lot higher. Gloria Sachdev with the Indiana Employers Forum says that's only part of the problem here, however.
We're fourth highest in the country for hospital prices and fourth lowest in the country for physician payments. So we really have two problems.
According to study authors, it's been that way for a long time.
So in several rounds, we found that prices in Indiana are higher than both the national average and higher than neighboring states.
The same preliminary data from RAND, a nonpartisan, nonprofit think tank that's compared procedure costs across state lines, found Indiana physicians make up comparatively less than in other states. The Indiana Hospital Association doesn't believe that, or other issues, or because of a lack of competition.
So it's a really competitive market here, and that's true of other markets in the state as well. But we do have a very large insurer that is the dominant player, Anthem.
But the study author, Chris Whaley, isn't convinced.
So we know that many hospital and other provider markets in the state of Indiana are relatively concentrated and dominated by large systems relative to what we see elsewhere in the country.
So it's a lack of competition among the actual hospital systems themselves.
That's certainly one contributing factor.
The physician share of those high prices is lower than in other states. According to data from the American Medical Association, the national share of independent physicians declined 5 percentage points in 2020, the largest drop ever, and the first time it's below 50% since the survey began in 2012. Back in Fort Wayne, Dr. Agarwal has no plans to stop fighting. She's trying to rally other physicians to get together, and while she admits her administrative costs to run her practice continue to skyrocket, she has no plans to shut her doors. It's the patients that keep her coming back. While many physicians stop doing hospital rounds as they get older, Agarwal exclusively does them now because it gives them more time with the people who need her the most.
Has the human body changed in 50 years? I don't think so. So what's the problem? I don't know. We're a capitalistic country. We'll make money off of anything, even human beings.
For Indiana Newsdesk, I'm Brock Turner.
The Kinsey Institute wants to bring healthy relationship education to rural high schools. That's because 27% of Hoosiers under 18 have experienced at least 2 adverse childhood experiences. Kion Terra has this report.
Adverse childhood experiences may be emotional, physical, or sexual abuse, domestic violence, or living in a household with a member who has substance use disorder, mental health issues, or who has been incarcerated. More than 47% of Hoosier youth have experienced at least one of these conditions. Yet, most healthy relationship programs, classes, and initiatives don't begin until high school or college.
The younger kids are that receive education on consent, boundaries, interpersonal relationship health, the more healthy their relationships will be long term.
The Healthy Relationships Institute works with school leaders and community organizations in rural Indiana to train adults and educate school children. The initiative focuses on digital safety, interpersonal boundaries, and healthy relationships.
The more that we are able to have the tools and the skills to be able to relate with one another in a manner that's positive, mutually supportive. I think those are natural preventative measures against sexual violence.
IU studies have found children in rural communities are more likely to experience abuse, neglect, and other maltreatment. Indiana ranks 38th in terms of parents' knowledge of adverse childhood experiences and their consequences. Megan LaRue is the social worker at Orleans Elementary School. She believes the fact that children receiving the program are excited and engaged proves it is necessary to have these discussions at this age. LaRue says conversations about healthy boundaries and safety online and at home are vital.
They're resilient, they definitely bounce back, but they are little sponges. They pick up on all of the things they see. And so I think just having those conversations and bringing it into their awareness earlier rather than later is going to have long-term lasting effects.
The initiative began in the fall of 2019. Lehman says they hope to deliver more training for school personnel and workshops for parents and community members in order to implement these programs. For Indiana Newsdesk, I'm Kayan Tara.
That's the end of this program, but our work continues online as we cover the news throughout the week at WTIUnews.org. Have a great weekend.
Indiana Newsdesk is made possible in part by Smithville Fiber Internet, streaming TV, home security and automation in Southern Indiana. More information at smithville.com. Maller Grodner Attorneys, providing legal services to clients and the community. Understanding, expertise, results. Bloomington and Indianapolis. LawMG.com. IU Alumni Association, connecting IU's network of alumni and sharing the Indiana spirit through scholarships, advocacy, and volunteerism. Alumni.iu.edu. IU Center for Rural Engagement, extending IU Bloomington resources to improve Hoosier lives in partnership with communities and organizations. Rural.indiana.edu. And by WTIU members.